Hello and welcome to a new episode of Majlis podcast by Emirates Hospital Group. I'm Wael Berro, family medicine consultant at Emirates Specialty Hospital. Today it's a great pleasure to have again Dr. Nigel, our superstar gastroenterologist. Dr. Nigel.
Assalamu alaikum. Thank you, Dr. Wael. I'm Dr. Nigel. I'm not going to spend a long time introducing myself, but I'm a consultant physician and gastroenterologist working here in Dubai and Abu Dhabi and London. And I've been working in Emirates Hospital in Jumeirah. So we're going to be talking a little bit about bloating. Over to you.
It's a small topic. I'm sure we can finish it in 2 minutes. But as a joke, I always say that you keep trying to escape me, but I keep following you, Dr. Nigel. So it's always a pleasure to have you as a colleague. And now it's great to have, we're both at Emirates Group. Let's talk about bloating. It's quite a big topic. And we hear it from every person saying that I feel a bit bloated. What exactly is bloating from a medical perspective?
So bloating basically is a feeling of persistent gas within the tummy. And I think we have to clarify that this is different from when you get some bloating after you eat. I mean, many people after they eat some food, they get a little bit of bloating or just, a bit of gas in their tummy for about half an hour or so. But that usually goes after a half an hour to an hour. But the kind of bloating that I deal with on a daily basis and that we're talking about today is persistent bloating where the gas really does build up, and it's not necessarily related to food. It can come at any time and it can be quite annoying.
Tell me about the gender difference when it comes to the medical bloating. Probably it's commoner in females, but why so, if we have a reason? And how does it affect day to day? What's the impact on the physical and the mental well-being of the patient?
That's a very, very important question, and I think it's a great question. So basically, I mean, bloating tends to occur more frequently in women, and at a ratio of maybe 2 to 1. So it's about 2 women for every 1 man suffers from bloating. So that's one factor why it occurs more frequently in women. And it's also related as part of the constellation of irritable bowel syndrome. So irritable bowel syndrome as a disease constellation occurs more frequently within women. The second issue, which is quite important as well, is that women go through hormonal changes during their monthly cycle. And so this can affect the amount of estrogens and progesterones. And this leads to the third point. Through both the hormonal changes, it seems that women's bowels move a little bit more slowly, generally. So when you put all of these 3 things together, that's why I think women suffer from it. And to go to your second point, which is even more important, many people would say, well, how can you be an expert in bloating and why is it so important? And it's not that important to men like you and me, but to the thousands and thousands of women that I've seen over the last few years here in Dubai and Abu Dhabi and in London. It's incredibly important because women are very, very sensitive and are very aware of their bodies. And so when a slight increase in the amount of gas in their tummy occurs, they can actually feel it perceptibly in how their clothes fit, and it can make them feel quite uncomfortable. I mean, I have hundreds of women coming and saying, I feel so uncomfortable, doctor, and I feel as though I'm pregnant. Sometimes the patient may feel that themselves, and sometimes other women, which is even more disturbing, say, oh, you look as though you're pregnant. And, many women don't like to be seen as that because they want to try to have a certain level of composure and attractiveness. So it really does affect their mental health, and sometimes they get very stressed from something as simple as what we might consider bloating.
Fair enough, and that's a very nice actually explanation. Thank you. So because the symptom is quite common, and because many people have bloating, when is it serious? When should I be worried? If I were a woman with bloating, when should I see you? And what will happen? When do you decide what investigations are needed, and how far would you investigate?
Okay, so the first thing, just to go back a little bit, is that when you look at traditional research techniques, they probably say that bloating accounts for about 3 or 4% of the population. But here in the UAE and in the broader MENA region, we probably see bloating in about 3 out of 10 people. 3 out of 10, that's 30% of people. So it gets to your point about why is it important to kind of sort out what we would consider the ones where we need to investigate a little bit more. I think the first thing to say is that all patients with bloating deserve an evaluation if they feel that it's affecting their quality of life or they feel disturbed by it. But to get to your point specifically about the alarm features or whatever, I would probably say that there are 5. The first one would be age. If you have entered and you've moved from a young age into middle age, which is classified as probably going into moving into 40s, 40 to 60, the middle age, that would be one thing. So if you develop new onset bloating, typically around the age of 40, that's one reason. The second thing would be if you have nighttime symptoms. You know, nighttime symptoms are more worrying than just having symptoms during the day. And then there's some other obvious things, which, for example, include pain or blood in your stool or a family history of bowel disease or inflammatory bowel disease. These would also be kind of important alarm features. Sometimes even things like anemia or feeling weak or hair loss can be associated with the bloating, and that can suggest iron deficiency anemia, which could point to a problem in the gut. And when we try to investigate these things, we basically, doctors are like engineers. We kind of see the patient, we take a history, we get the story, we examine the patient, and then we need data from the patient. And that data is typically, for the first stage, blood tests, stool tests are incredibly important, sometimes breath tests, and sometimes an abdominal ultrasound where you put some jelly on the belly and you scan the belly. So the first blood test that you probably do is some tests to check for inflammation, also for gluten intolerance and celiac, sometimes thyroid disease, and for inflammation. And then from the stool, you often check for inflammation, parasites, other evidence that there's inflammation in the colon. And then from the breath test, you can sometimes look for what's called 𝗘𝗺 𝗶𝗿 or small intestinal bacterial overgrowth. And finally, with the ultrasound, which is a scan of the tummy, it looks basically at how much gas and the distribution of the gas, whether there are any abnormalities in the organs. And furthermore, it also can look at the diaphragm to decide whether there's any abnormal movement of the diaphragm. Because we have lots and lots of my patients have what's called dyssynergia, which is a complicated word, but it basically means instead of the diaphragm coming up, the diaphragm pushes down. And when the diaphragm pushes down, your belly will bloat out because your diaphragm is pushing your gut contents down. So that can be seen with a dedicated ultrasound specialist, and that would be a useful thing to see. And if obviously those tests are not helping, then we need to move to second level tests, which are more invasive tests like colonoscopy, endoscopy, capsule endoscopy, etc.
Perfect. Thank you again. So I like actually, by the way, that when you said doctors are like engineers, I usually we call ourselves police detectives. We're trying to investigate and then we try to get evidence to confirm what we have. And basically, bloating could be coming from the digestive system, and as you summarize it, or could be from outside. And that's why it's important to get the full history. And each person and each patient is different. We live in an era of food allergies and more awareness about food allergies and the overlap with food intolerance. And we know a lot of the bloating sometimes could be related to certain food. How do you advise people when it comes to their eating habits? And what is FODMAP and the role of FODMAP in all of that?
That's a great question, Wael. Sometimes some patients feel that bloating is a simple thing and they just come and say, "Doctor, give me a medication and it will go." But as you know, the deeper you dig into certain conditions, the more it becomes like a 1,000-piece jigsaw puzzle where you have to try to put many of the pieces together to try to work out what's going on. I tend to approach this with like a kind of 3-pronged approach, right? There's some really, really easy fixes, really easy fixes which people can do immediately when they come to the clinic. So what are these? Number one, I can tell them avoid fizzy drinks, Coca-Cola and, fizzy drinks, liquids with gas, because obviously you're putting gas into the system already. Yeah. Number two is to avoid kind of a lot of processed food and high fructose corn syrup and lots of processed food, because that's not kind of good. That causes gases. So those would be the 2 quick fixes. In the second kind of part of this, there are like, before we move to more advanced dietary manipulation, we can think about these things, which I have to say to the patients because they don't realize how important these things are. The first thing is, in our time-pressured environment, you have to eat slowly and chew your food. Eat slowly and chew your food, and don't drink lots of water when you eat your food, especially fizzy drinks. The second thing is really important is that we've shown that like 20 to 30 minutes of just walking, after a meal or just walking during the day improves your overall health significantly. And another thing which people often hide under the carpet is that sleep is really important. Sleep is really important, and you need to sleep at least about 6 to 6.5 hours a day. In fact, some studies have shown that you can have a significant decrease in your bloating just from these three things. And I think they probably work on the adrenergic or the stress axis on the body. So that's the second part. So those kinds of things. Another thing that you can sometimes do is you can begin to perhaps try to cut down on very common culprits like lactose. Many, like 10% of Arabic people within the Gulf region have lactose intolerance. So avoiding milk, or certainly cow's milk, can be very helpful. And then the last thing is perhaps trying a trial of gluten removal for a few weeks, because that can sometimes help. If all of these, the things that we've described now hitherto, are not working, then we may suggest going to what's called the FODMAP diet. And the FODMAP diet, quite simply, is an exclusion diet of about maybe 70 different kind of foodstuffs, some of them including milk, some of them including gas-forming legumes, and also fructans and some other kind of chemical compounds, which are well-known common culprits for gases and bloating. So what we typically do is we usually have a FODMAP delivered usually by a dietitian, in like a boot camp, which can basically kind of tell the patient to come off all of these foodstuffs for about 4 to 6 week period. And then after that, one by one, they begin to systematically introduce one by one. And if they notice the bloating, they say that's a bad food. And if they don't notice the bloating, they can continue. But the problem with the FODMAP diet is sustainability, and whether you can incorporate that into your daily living in a long-term thing. And also sometimes you can have micronutrient deficiencies if you stay on a FODMAP too long. So another last thing to say is that some people will do what we would call like an 80-20 FODMAP, like an 80% FODMAP. You do kind of, you try your best at a FODMAP, but you don't go for the perfect FODMAP because you're scared of micronutrient deficiencies.
Thank you. Are you sure you're just a gastroenterologist and not a family doctor as well? Because I love how you focus on lifestyle and part of your treatment, which is redundant to my next question, because I was going to ask you about treatment, and I know you covered it as part of the options that you mentioned earlier, that people should sleep, should eat, should exercise as well. So, but let's talk about medical treatment. If I'm coming to see you and I have bloating and you've done all this tests, and what sort of things that I should try, let's start maybe from that part, I should try over the counter before I see you, or if I have red flags or I'm not well, I come and see you, and then you're going to give me prescribed medications.
Well, I think that's a very important question as well. But I think another important question, just to pre-answer as well, is this: sometimes bloating can be a benign condition, and sometimes it can have these alarm symptoms that we talked about in the past. But sometimes, it can really signify significant illness and significant problems. And the problem is that in many cases, when patients go to doctors, many doctors, I'm not saying all doctors, but many doctors pass it off and say, oh, you've just got a bit of bloating, take some medication. And then they miss important diseases like celiac disease, sometimes cancers, etc., because they haven't really addressed it in a systematic way. And so I entirely agree with you, Wael. Doctors, we have to be systematic. We need to consider ourselves as the last person standing, trying to help the patient, and approach it in a systematic way, which is why I'm telling you this. So with regard to the medications, the over-the-counter medications, which are quite helpful, include simethicone, which I think many people are aware of, which can come at certain dosages. One, which is my go-to medication, is peppermint capsules. People go, Why have I come to see you, Dr. Nigel, and you're just giving me peppermint? Because peppermint is one of the blockbuster drugs in dealing with bloating. A few people don't tolerate it, but many people do. Another thing that can be quite helpful from, our forebears, our ancestors, we know from my mother and my mother's family and my grandmother, etc. What's really important? Gingerbreal, ginger is really important, isn't it? Yeah. Ginger can help with nausea, ginger can help with digestion, and certain other kind of herbs. So for some of my older Emirati patients, even we find black seed, 𝗘𝗺 𝗠𝗷𝗶𝘀 can sometimes really help. Obviously, if it's not mixed with honey, and that's really important. But let's go to if we've gone past the over-the-counter medications, which I've described just now, then we have other kinds of slightly more important ones, and those include both probiotics on one hand and antibiotics. So probiotics are bacteria enough, they kind of are supplying good bacteria to the microbiome of the gut to try to improve the bloating. And antibiotics work by trying to throw a bomb effectively into the gut to try to destroy hopefully more of the bad bacteria than the good bacteria to try to rebalance the microbiome or the balance of good and bad bacteria, because certainly there are bacteria within our gut that are gas forming, like methane forming bacteria. So we often use a medication called rifaximin, 550 milligram tablets, like 3 times a day for a 2-week course. And that can significantly lead to improvements in bloating and brain fog and many other conditions that are associated with the bloating. If these kinds of things don't fail, then we need to go perhaps for some more advanced techniques, which we'll talk about perhaps later.
Now, you mentioned the probiotics, and it's such a confusing topic. And I know the microbiome is one of your expertise, and I know we talked about it in the previous podcast, but briefly, if I were to ask about it from a context of bloating, today's episode, what is emerging, what's coming, and how do patients have to know probiotics, prebiotics, and which probiotics to take, and what's happening with the microbiome in the next couple of years?
That's a fantastic question, but that needs a podcast in itself. But let's just talk about that. So basically, probiotics are bacteria, good bacteria, that can help support the balance of the good and the bad bacteria within the gut. If I were to take the probiotics out of your gut right now and measure them on a balance, do you know how much they would weigh?
I would lose definitely a couple of kilos.
2.5 kilograms to 3 kilograms of bacteria we're talking about. So it's a lot of load. Right. The difference between a probiotic and a prebiotic is a prebiotic is the food that a probiotic eats. That's the difference. And then you can sometimes have something called a synbiotic, which is a combination of a prebiotic and a probiotic, which some people can take. So as you said, there's so much complication in which probiotics to take. But these days, with many of my patients, as we have spoken about in another podcast, we have new shotgun metagenomics where we can analyze stool samples and look at the exact bacterial signature of individuals. And from that, we can then target not only specific probiotics, which can help patients specifically, but we can also have specific 6-week to 8-week precision dietary programs made up, and it's been proven with some of the techniques that we use in this, for example the N-biosis model, that you can improve bloating by up to 30 to 40%.
First, it's always a pleasure, Dr. Nigel, to have you, and thank you very much for squeezing all this information in a short time. I think definitely gut health is the system to watch in the near future. It's very exciting what's coming up next. So thank you again. Any take-home message you want to tell our audience today about microbiomes and about bloating in particular?
I think I would like to say that if you have bloating, don't ignore the symptom, because if it's causing a problem for you, probably it's a good idea to come and see someone who's an expert in that area so they could look at it in a more systematic way and try to exclude, the kind of more worrying diseases like gluten sensitivity, etc., but also to try to go through the different approaches in a systematic, comprehensive way.
This brings our episode to an end. Thank you for staying tuned and listening, and please stay with us for a new episode of Al Majlis podcast by Emirates Hospital Group soon. Thank you again, Dr. Nigel.
Thank you, Dr. Wael.